Our text number is 077 488 55055. So if you have any WhatsApp questions you might want to ask, we have a group of experts on the show with us this evening, so you can ask any questions on various different subjects. So please, anything to do with the NHS, please send your questions in. First of all, I wanted to say Ramzan Mubarak to the listeners who I haven't spoken to or haven't heard me on the radio recently. So Ramzan Mubarak to everybody. And I'm on day 9, but I know a lot of people are on day 10. So mashallah, you've completed one third of your Ramzan is already done. Wow, fantastic. And I hope Ramzan is going well for everybody and they're enjoying Ramzan this year, even though we're in a sort of semi-lockdown at the moment as well. So the guests that we have this evening, and we're going to be talking to all three of them, is, first of all, I'd like to introduce Dr. Mangesh Murutka, who's joining us. So good evening, Murutka. Thank you very much for joining us here on Radio Ramadan.
Good evening and Ramadan Mubarak to all the listeners.
Thank you. Thank you. And then we are also joined by another expert. These are both of them are consultants in Leicester Partnership Trust in various different fields. Mangesh is a specialist in care of elderly with patients with mental health disabilities or issues with dementia and Alzheimer's. And we're also joined by Dr. Abe Rathore, who's a consultant specialist in younger people, in CAMS they call it. So good evening to you, Abe.
Good evening, Zuffar, and Ramzan Mubarak to all the listeners.
Thank you very much, Abe. And also we're joined by Hitesh Pandya, Dr. Hitesh Pandya, who's a consultant pediatrician, but also now works in the private sector. Good evening to you, Hitesh, as well.
Hi, good evening, everybody. Ramzan Mubarak to everybody.
Thank you very much. Right, we're going to start with Mangesh, and I first of all thank you very much for coming on. You specialise in the care of elderly people with mental health issues. Just explain what you do and how long you've been working in that field and the kind of patients that you cover.
Well, good evening, everybody. My name is Dr. Marudkar. I've been a consultant in NHS in the old age psychiatry services for over 20 years now. And we cover quite a broad range of work within the old age psychiatry. We have domiciliary services, outpatient services. We have got inpatient services for people with severe mental health problem. And we also specialist services like the memory clinic or liaison psychiatry for acute hospitals. And so we cover quite a broad range of services within old age psychiatry.
And do you see lots of patients from the ethnic minorities in the hospitals, inpatients, and how do you go around helping them?
Well, in fact, if you look at the statistics, from in the acute medical ward, certainly there's a substantial number of patients from ethnic minority, and I suppose they come there for physical health problem, different kind of physical health problem. But in the mental health services in the hospital, certainly we see proportionately less people who get hospitalized to the mental health wards. Also in the community, we notice that we don't see people with mental health problem in the earlier stages as much as we see people from other backgrounds. So it is the impression that the ethnic sort of South Asian or ethnic elderly don't come to the attention of the services soon enough.
So Mangesh, does that have a detrimental effect? Does that damage their chances of recovery or length of life and issues? Does that?
At the very least, it prolongs their suffering without treatment. And depending on what the nature of the problem is, it can get reversed at different stages or not, as the case may be. But certainly not seeking help means that they suffer for longer, which in most cases may not be necessary.
So what kind of things could they be that they suffer from that nobody notices and they present too late effectively for you to support them enough?
That's right. I think that again, the commonest 2 or 3 problems we see are people who are depressed or who feel very sad and who are not able to enjoy life for all sorts of reasons. Some of them have physical causes for that. Some of them have depression. Some of them have some other environmental, psychological reasons why they are feeling depressed. But without an assessment, one wouldn't be able to guide them in the right direction. The second most common reason why we get referral, which are a bit late, is, as I said, memory difficulties. Often they get unrecognized. Often there is a perception that it is normal for somebody who is older to feel confused or a bit mixed up, which isn't necessarily the case. And so often they don't seek help till things reach a serious point where there is a significant problem in supporting them or helping them. But by then, several months, possibly years have gone by, and they have suffered quietly. And the family also suffers, not just an individual. Their family also suffers because they are perplexed, they are distressed, they don't know what to do. They try their best, but clearly without a sense of direction as to where we are going and what might be the best way to help.
So if somebody has that problem of memory loss and they think that something's not quite right with either their parents or relatives, whoever they might be, the best thing, first port of call is really the GP?
First port of call is GP, certainly, because in quite a few cases, it might be a relatively simple intervention, straightforward intervention, which can be done to help the matter. And it is a complex matter. I won't confuse by going into technical issues on this, but people who are not going out, who are not keeping their mind and their body active, they can get a bit mentally confused simply because they are not being stimulated properly. They are just sitting, they're lonely, which is again a very big problem for all elders, not just the elders from the South Asian background or any ethnic minority background. So being out and about, being mentally active, simple prescription of activities and exercise can help improve their well-being, their memory, and their general mental agility. So for anything more serious, of course, the GP can refer them to either our services or whatever is the right specialist services for them.
So physical activity is really important for their mental health as well.
It absolutely makes so much of a difference. And I think across the world, if you look at the research, one thing which has come across is being physically active and being mentally active is good for not just for your body, for your heart, for your muscles, but also for your brain.
Yeah. And you talked about memory loss and memory clinics. And so what happens to people when they struggle with their memories? How does that, and what would your tips be to help keep somebody as sharp a memory as possible?
Well, first, the memory loss in the elderly, the common reason for that is a kind of word which often people don't speak about, is dementia. But besides dementia, there are many other reasons why people can feel confused or mixed up. Sometimes it could be a side effect of the medicines they are taking for their blood pressure, for their diabetes, for their other physical problem. As I said, and sometimes it could be some chemical imbalance, some hormonal imbalance or some chemical abnormality in the body, which can make them confused. So not everybody who's confused has dementia, certainly. So the first step, which is what the GPs quite regularly do, is to check out for other reasons why somebody may be confused. Now, if that helps, that's great. You don't need to go any further than that. But if it doesn't help, then they can refer them to the memory services. Now, within the memory services, we do a detailed assessment and we establish whether their memory difficulties are consistent with what we call as a dementia diagnosis. And depending on what type of dementia it is, we might give them different medication or different advice. Now, dementia is a chronic condition, and sadly, we don't have any cure for dementia. It's like any other chronic disease. And I always say, arthritis, heart disease, deafness, blindness, all of these are chronic diseases which can't be cured. But if you do the right treatment and manage them the right way, you can lead a very productive and a very meaningful life with the condition. So the trick is to manage it more effectively rather than look for a cure, which sadly at this point in time, we don't seem to have.
And lots of your time is spent helping patients manage those conditions and their families manage those conditions.
Absolutely. And we, along with in partnership with the voluntary organizations like Age UK, like Alzheimer's Society and several others, there's plethora of information out there for people to read. There are support services. There are people who can direct you to different sources, because I can imagine it's a mind-boggling thing sometimes, somebody who has never had to deal with any of this, to suddenly find a system which is quite complex as to where do you start getting the help. And there are advisors and support people who can actually take you through, step by step through to different sources of help. But the first step is having that knowledge and information available to you so you can choose wisely as to what might be the most useful help for you. Each person is different.
Thank you. Yeah, and you're listening to Radio Ramadan on 87.9 FM. Our WhatsApp text number is 077 488 55055. I also want to give a shout out to Afroz Mia, who's on a 130k collection, running along Evington Road in the next few minutes, and we'll be arriving hopefully inshallah at Masjid Umar at 6:30 after doing a sponsored run across the country. So we'll look out for him along Evington Road at some stage in the next half an hour. Mangesh, another question that keeps coming up. You mentioned Alzheimer's. What is the difference between Alzheimer's and dementia? Because they're two different things. And one of the things that was mentioned today in the news was that COVID last month has been overtaken by dementia and Alzheimer as the highest number of deaths. So what is Alzheimer's?
Alzheimer's is one type of dementia. There are quite a large number of different types of dementias. The commonest dementia type is Alzheimer's, and that's partly why people often use Alzheimer's and dementia to mean the same thing. It's not always the case. So about 50% people who have dementias have it because of what we call it Alzheimer's dementia. And then of the other 50%, the second most common dementia, which incidentally is more often seen in people from South Asian background, is what is known as vascular dementia. That's where the dementia, the damage to brain is because the blood supply to the brain is affected. It can be because of stroke. It can be because of slow buildup of furring and narrowing of the blood vessels. But those are the two most common kinds of dementia. And then there's a long list of other types of dementia. So Alzheimer's is one type of dementia.
Right. Okay. Excellent. Thank you. And what would your top tips be for somebody? You know, you see lots of patients in hospital. You've been doing this for a long time. What would your top tips be for people who might be struggling out there? What should they be doing to keep themselves mentally healthy and physically healthy? In you know, especially we've had this lockdown over the last year, 18 months. It's made the situation worse for a lot of people, no doubt.
It is. I think last 12 to 14 months have been complete nightmare in terms of advising people on how to efficiently do what is good for their brain and for their body, for that matter. Luckily, even at the worst of the lockdown, the government had permitted going out for exercise at the very least once a day or more. And I think people should make use of that opportunity. You know, use all the safety measures, the mask, and you name it. But being out in the sunshine, being physically active, sweating out a lot can do wonders to your body and your mind. And those who are already having symptoms of dementia, clearly the magnitude of benefit is that much smaller. And so my advice to most listeners is start young, because earlier you start, greater the benefits will be for most people. And so yes, being regular, and it's not just about season, that kind of 1st of January or New Year resolution, which doesn't last for more than a week or so. It has to be part of your lifestyle changes, and you will see that you can lead a healthy, happy, physically able, what we call a disability-free life in the older age.
Yeah. So the other thing is that I know lots of people who watch TV when they're just at home, or they're doing crossword puzzles or Sudoku or whatever they might be doing, reading newspapers. What would you say to that? Is that a healthy pastime, or would you say other things are more beneficial?
Well, sitting in front of TV is one of the worst thing anybody can do, in my view. But again, you know, TV has its role to play. And jokes apart, I'll tell you, some people can have a little bit of exercise machine in front of the telly. You don't need to sit to watch TV. Why can't you have a stepper? Why can't you have a twister? Why can't you have a cycle? Why can't you have some little piece of machine that you're working while watching TV? So you're using your time meaningfully. I think the stagnant body does a lot of harm. And of course, I don't know if you probably have heard, and a lot of listeners would have heard, sitting is the new smoking. And people who sit for hours and hours, they're doing so much damage to their own well-being. and being up, being active, even armchair exercises. People who can't walk or who can't stand safely, you can be active physically, and you can do armchair exercises, and even something is better than nothing. When it comes to mental exercises, I always say to people, any exercise is better than nothing. But within the exercises which are available mentally, I think if you do those which have practical relevance for your day-to-day life, remembering names of your family and friends, remembering directions around your town, remembering your shopping list, remembering who came, who went, and just summarizing what happened in the last week, or doing a bit of a game and fun is, I suppose, better than playing Sudoku, which may not have much practical relevance in our day-to-day life. How often do we need Sudoku for our day-to-day living? But we do need shopping lists and names of family, friends, and birthdays and stuff like that. So having exercise, practicing on those domains can be a lot more beneficial than doing something which is a lot more abstract and may have no direct relevance to your day-to-day life. Cooking skills, pick up a new hobby, something which has practical relevance. Cooking skills, new languages, having a bit of fun and laugh that gives you a bit of socialization, a bit of mental stimulation, keeps you physically active, have something target set for you. It gives you a lot more sense of mental well-being.
Excellent, thank you. So, lots of people, we hear somebody's taking up, is going to do a GCSE in French, or is going to learn Spanish, or is going to learn a language in their 60s or 70s, or cooking, or take up pottery, or whatever they might be doing. So you would encourage that, because that's something that is of interest to them and not just something that they're just doing for the sake of it.
Absolutely. And any new stimulation to the brain generates new connections in the brain, keep the brain regenerating itself nicely. And so, yes, anything new which pushes the brain slightly out of comfort zone. And there's a fine balance to be struck. You don't want to take on such a massive adventure that it overwhelms your brain and completely freezes because you can't handle it. But also, if you always stay within your comfort zone and don't try to push the boundary, your brain will get dull and dull, because clearly it's not getting new stimulation. There's no reason to work on its all cylinders, so to say. So I would encourage people to take up hobbies which they like, because they're more likely to persevere with that. And also something which has got practical relevance and give them that social, physical stimulation at the same time.
Excellent advice. Really, really good to hear that. And, the stimulation of the brain is really, really important, obviously, as you've just said. And that is really positive, because if they're doing something practical, remembering names, remembering the shopping list, and remembering those practical things. I know I'm always in trouble forgetting something when my wife tells me pick something up from the shop. Maybe I need to try and do a little bit more of my memory as well. And
join the club.
Join the club, yeah. And really good practical advice. And you hear so many people. So get out of the comfort zone effectively in some cases, because life gets too comfortable. Get out of your comfort zone and maybe do something different, but stimulate the brain at the same time and encourage yourself and push yourself a bit harder.
Indeed. And I think one of the reasons often people tell me is the fear of getting it wrong, or fear of failure. They almost feel that if they can't get it right, they better not do it. And that is one of the saddest things, because clearly we all get it wrong nowadays, now and again. And as long as you're not harming anybody by getting it wrong, it's okay to get it wrong if you try something new and don't quite make it as well as you're hoping for. I mean, clearly, I wouldn't suggest things which will hurt somebody. I wouldn't want anybody to sit behind the wheel and start driving if they haven't driven for many years, because it can be dangerous. But there are very innocent mistakes. You can make mistakes which are harmless, and that's fun. It's okay to do that. I would encourage people to do that, certainly.
Yeah, I mean, if you're picking up cooking and it doesn't turn out, but keep trying and keep doing those things. I mean, even the Queen makes lots of mistakes. Everybody makes lots of mistakes. So there is issues, and people get on and just move on, because that embarrassment is not there. It's not really true, is it?
Absolutely not. And in fact, other people appreciate you making an effort. They're not looking for perfection. Your family, your friend, they will all acknowledge the fact that you tried it, not whether you got it right or not.
Yeah, Exactly. Yeah, thank you very much, Mangesh. Is there anything else that you want to add, any tips or anything else that you think people should be doing? Because this is going out quite wide to a large community listening in. Any other messages that you want to say? Because you are on the forefront of dealing with these patients when they come into hospital. I know that you and your team do a fantastic job in doing the best possible job for these people, and lots of times I know that you speak in different languages to different people as they come in. How do you find that, and is there any particular message that you would always like to pass?
Well, one of the strengths I noticed, and this is not unique to South Asian community, but one of the strengths and relatively stronger point is the extensive family support I find they have. And the families just, marshal together. They provide a brilliant support for people who are suffering with mental health problem. If there's one thing I would want them to do more is to develop some ethnic or culturally specific or sensitive services which are for elderlies from that kind of background. Because most of them, if you want to go for some day activity, I'm not talking about the last 12 months, which has been a very, very different, but in terms of community activity and organized activities, there's a need for more of the culturally, ethnically, and linguistically appropriate services, which are lacking, sadly. And it's a bit of a catch-22. Unless there's a demand, the services won't be created. But unless there are services, people won't know what to ask for. So somewhere we need to break that circle and have some services which are geared up for people, which are suitable for people who perhaps don't speak English so well and whose dietary habits and cultural habits are different.
Yeah. Are you talking about day trips or visits and just generally outings?
Yeah. I mean, your imagination is as good as it can be. There's nothing to stop you from thinking. And I'll give you an example of an incident that happened 2-3 years ago, admittedly. I was with a group of people and their families. And among the discussion, one of the questions was asked was that there are no ways, or people are finding it very difficult to go on holidays with dementia and their carers. As it happened, incidentally, within that group, there was a lady who was looking after her mother. She was a senior staff member of a travel agency. And she said, well, if you are interested, if you let me know, I can organize one. And within half an hour, there was a trip booked with 25 people already booked for that trip to go to a seacoast, people with their dementia and their family members. It was so heartening to see that when so many people come together, ideas bounce off each other, and before you know, something fantastic, something new comes up, and you say, wow, I didn't expect that, but something new comes up. But if everybody is living in their own houses, bit embarrassed, bit ashamed, bit not sure what to do, feeling lonely and stuck, clearly that kind of mutual interaction and the benefit is missing. And I think for a lot of ethnic elderly and ethnic families or families from Southeast Asia, I see that kind of coming out and seeking help, talking about it, and actually saying, you know what, is there anything out there? I got these ideas. How can I take it further? Those things are somehow not happening as much as I think they should, because that can make so much difference. And it gives us such a sense of relief to families who are all bottling it up often and not speaking about it because there's a stigma, there's a bit of a taboo, a bit of social expectation that, you shouldn't be doing this and you shouldn't be doing that. All sorts of misbeliefs kind of hold people back from getting the right help in a timely fashion.
That's a fantastic sort of example that you've just given. Really, really encouraging, because I think there's lots of people who are individuals who are suffering with the same problem. There just needs to be some kind of getting together of people and getting together of ideas and being able to use that.
Your radio station can help in that.
Yeah, I'm sure we can. The WhatsApp number for any messages that you want, or questions you might want to ask, Dr. Mangesh will be with us for another half an hour. The number is 077 488 55055. That's our WhatsApp number. Please send us a message if there's any questions you might have. Before you go, Dr. Mangesh, I just wanted to say a big thank you on behalf of patients, because I know you care for all sorts of people across not only Leicestershire but elsewhere as well, and for you and your team doing a fantastic job. And I know that you support lots of Asian patients that come into your care as well, speaking different languages and doing whatever you can. Really appreciate your efforts and the efforts of your team. and the NHS generally as a whole, because you do a fantastic job, and we're great to have you on our radio station, and all the rest of the people who are listening in as well, who work in our fantastic NHS.
Thank you very much.
Thank you. Please join us after the break. You're listening to Radio Ramadan on 87.9 FM. Our text number is 077 488 55055, and join us after the break, where we'll be talking about younger people's mental health issues. sisters. You're listening to Radio Ramadan on 87.9 FM. Our WhatsApp message number is 077 488 55055. You're listening to Zuffar. I'm your host for the NHS show this evening. Every Thursday evening between 6 and 7, we'll be talking about issues relating to your health. And today we've got 3 experts on with us this evening. And we're now going to be talking to Dr. Abe Rathore. Good evening, Abe. Hope you're well.
Good evening, Zuffar. Thank you very much. I'm very well. Thank you.
Good. Just describe, Abe, what do you do and what kind of consultant are you and what kind of people do you treat?
Zuffar, I work for the Leicestershire Partnership NHS Trust, and I'm a consultant psychiatrist. I specialize in looking after young people, and especially the age range between sort of 13 and 18. And I work at the inpatient unit, so looking after people who are struggling to look after themselves in the community and who need specialist intervention inside the hospital.
So, and have you found over this lockdown, COVID, you've had more cases to deal with in patients, and how have you been able to help them?
Yes, it's been an unfortunate side effect of this pandemic that due to the lockdown and restrictions, lots of services that were available in the community have gone down. And that's why we have seen an increase in the presentations that come to A&E or people presenting in crisis, which then leads to some people getting admitted. So we have seen an increase in admissions and increase in the demand. People are having to go out of the county. So yes, it has been a significant increase in mental health difficulties.
And generally, the people that have identified and ended up in your hospital under care, do they generally get better quickly and then get back, or is it a long process, and does it take quite a long time for people to get better once they've struggled? The timelines for mental health recovery are a little bit different to the physical health recovery. So we probably count in weeks rather than days. So on an average, in our setting, 4 weeks to 6 weeks is the timeline that we work on for young people to come and sort of settle down and then feel better. But you've got to sort of remember, we got to remember that some of these patients are presenting with sort of lots of chronic difficulties which have been present for a very long time, or they present in a severe state of distress. So it takes about sort of week or 2 weeks for them to sort of settle down, start talking to the staff, start responding to the intervention, the therapy, the medication that we start, and then the recovery slowly takes place. 4 to 6 weeks is an average. Some people recover a little bit earlier and then go back into the community. Some people take a little bit longer, but a lot depends on what is the package of support available for patients and the families in the community, because we try and sort of keep the duration as small as possible, because the recovery work happens a lot better and a lot more in the community. And talking to young people, we've all got children, we've all got people who are teenagers. It's really quite difficult sometimes. What are your tips to try and communicate with them, and how do you find the best way to communicate with them is? Because you sometimes don't understand the problems they might be going through, or...
Yes, you were absolutely right. It is a challenge, but the simplest way, I would say, is to try and sort of get down to their level, not try and sort of talk down at them or to explain or say that we know better, but it's more about the genuine curiosity of trying to understand what their difficulty is, where those challenges are, and be open in your head that sometimes it might take more than 1 or 2 sessions for them to feel comfortable before they will talk about. For example, I'm pretty open about my lack of knowledge or understanding about the current level of technology or the different apps going on. And that makes them feel comfortable that, okay, I'm not an expert in everything. There are something that I don't know as well. And they feel more comfortable talking about that, which sort of opens up a little a channel of communication where then I can sort of go in and start to explain what I can do and how can I help them. And they feel more comfortable. So that's how the communication starts to flow.
Yeah, and that seems to work. You've got to get something that they associate with and talk to them at that kind of level just to get their confidence. Somebody else was talking about, well, we've got a worry wall in their house, so they put little stickers. The teenager will say, "I'm worried about my school," or "I'm worried about something," and put that on there. Does that kind of sort of thing? You've got to understand what they're worried about, because a small problem to us might be a major problem to them, which they don't understand and comprehend.
Exactly, and that worry wall concept probably will work for a slightly younger age range rather than teenagers, because teenagers might sort of feel a bit more embarrassed about that, so they might be more comfortable sitting down in their room or sitting down comfortably when you're watching TV and sort of have those conversations about what's happening in school, what's gone well, what's not gone well, and then sort of slowly introduce a couple of topics that you might want to ask about kind of thing. But yes, those worry walls, or sometimes sharing what might be worrying you. But you have to be mindful that when you share that, you always have to sort of maintain that sort of parental role, that you don't want to overburden them. It is more about just making them aware that there are things, for example, in the pandemic situation, the loads of unknowns and everybody's working through that in their own way. So it's more about making that there are certain things that you don't know as well, but this is how you are managing, this is how you are coping. And they then start to feel more comfortable that, okay, if I can't go on holiday this year, we'll plan it for the next year. Or as the lockdown opens, we could probably plan a little day trip to the seaside. So it's more about helping them think a little bit more about what the positives are, rather than just thinking about what the worries are and not being able to find a solution.
That makes sense. Obviously, the more positive they can be, the better off they're going to be in their well-being. And what are your top tips for communicating or just generally dealing with young people and actually trying to help them along, really? What have you found works really well that we might need to think about?
It's more about sort of being that consistent person where they feel comfortable to be able to share their worries and concerns. Like you said at the start, what is the way to communicate? It's more about trying to get that balance between you wanting to understand them, but not pushing them too much. It's more about letting that flow happen, the flow of that conversation, flow of that communication. Because sometimes when you push too much, it can make them close up a little bit as well. So it's more about when they are in a reasonable state of mind, more, and again, you need to develop that habit of conversation about sort of sitting around the meal table and just checking how was the day, how did everybody do, and sharing your own bit that, okay, I had a difficult day today because of this and this kind of things, and they feel comfortable, okay, this is normal, that everybody has a difficult day and this is how it can be managed. Sharing and being aware of what's going on in their friends' life, in their school life, in their sports life, that kind of thing makes them more comfortable so that they don't have to start a conversation from anew. So it's more about developing that pattern of that consistent conversation all along, rather than hoping that when things go into crisis, then suddenly they'll open up and share everything.
That's a really good tip, actually. And I know you mentioned before when I was speaking to you some time ago that, kids watch a lot of YouTube videos, they watch a lot of videos, and that always sort of makes me think, well, why are they watching this? And you had an interesting insight into that. Just tell us what you found.
Yeah, that was a very interesting conversation I had with my son, because he was watching lots of YouTube videos, but he didn't start to watch other young people play video games. And I was very sort of surprised that, why are you watching somebody else play a game? You play a game, I can still understand, but why are you watching? And then he then turned around and said to me, well, why do you sit and watch cricket? There are other people playing. It's the same thing. There is somebody else who's playing a game that I also play, but he's better than me. And that sort of made me just stop and think a little bit that, okay, I've never thought about why I sit and watch cricket and I enjoy it, because I'm not playing, I'm just sitting on the sofa. And then further on, we have the discussion that e-sport is becoming more of a thing, and there are lots of tournaments organized where teams participate. So for me, it was a very interesting thing, that something that I was sort of talking in a very negative manner. There are thousands of people who are doing that, and it's more about that, having that open mind to think from their perspective. Okay, what is it that they are looking into? What is it they're trying to gain from there? So that was very interesting insight for me.
Thank you very much. Yeah, that's excellent. Abe, it's always very complex to deal with young people, and you've been doing your role for many, many years. What would you say, from your point of view, has been, the real issues that you think people should be aware of, or something that they can do practically to try and help young people just generally?
I think what I would say is that over a period of time, we slowly are sort of losing that conversation bit that keeps things flowing normally. As people get more and more busy, somewhere we lose that conversational ability to keep talking about things and being aware of each other's difficulties and challenges. A little worry about homework, or a little worry about a little exam coming up, or a breakup of friendship in the school, or an incident at the playground, they get sort of unnoticed, and that is where things start to sort of bubble up. And the other element of that, what I have realized over a period of time, is that time is such an important thing. When you start to sort of look at something, you've got to sort of work at it at a pace, and don't be in a rush to resolve everything there and then. These things take time to develop. These things take time to resolve as well. And you need to have that patience and ability to just work at it in a slow pace. And again, I'm not saying that for the general public and community consumption. This is something that I've picked up in my clinical work as well. You asked me about the timeline that people need in the hospital kind of thing. I have realized sometimes I would get sort of wanting to know, I need to solve this, or I need to solve that problem. And then I've realized, okay, if I back off a little bit and probably let it settle down for a day or two, I get better result. People feel more comfortable. So it's more about using the time at that pace, that you need to sort of work at it at a reasonable pace to work through that difficulty and challenge. And more you're aware of it, the young people feel more comfortable in that conversation, communication in the home environment that flows a lot more naturally.
Thank you. One of the things that you mentioned there is, people are distracted, lots of sort of issues. I know when sometimes I've gone for a dinner and everybody's on their mobile phone, nobody's actually talking to each other, even while having a meal. And that's happening more and more because of lockdown. Everybody has access to the internet and sitting with their phones. That is quite damaging, would you say? Or is that?
I think what I would say is that, yes, mobile phones are a very good thing. They've become a necessity nowadays. We do so many things on the mobile phone, but it's like the balance that we have to have for everything. You need to sort of have certain sort of habits. Earlier on, we were talking about sort of physical activities, very important for mental health. Similarly, excess of anything is bad. Overall, over usage of mobile phones will not make you do other things. So having certain sort of rules and regulation that, okay, from example, this time to this time, we'll switch the mobile phones off and you need to put that away. And the thing is, parents need to do the same sort of thing. You can't sort of advise something that your child should do, but you go to bed with the mobile phone next to your bed and you are on the phone all the time. So it's not good to just say that you should do this, but you don't follow the same thing. Having those simple basic habits that, okay, don't check your phone first thing in the morning, don't check your phone before you go to bed, because then you'll be carrying those worries all the time. Don't sort of allow all those sort of pop-ups and alerts and alarms to come and trouble you, because they will distract you and you can't focus and do your work, what you need to do. So it's a balance. I think the mobile phones are here to stay. They are a necessity now, but it's more about having a balanced use of it.
Yeah, exactly.
I don't know if you're aware or not. Just wanted to share that on our ward, we have allowed the use of mobile phones, because first we were thinking, okay, they can be damaging, they can be difficult kind of thing. But we have now moved to the viewpoint that if we try and help the young people understand how to use it in a reasonable manner, that's a good skill that they'll develop when they leave the ward. And thankfully, it has gone well. Young people, they have certain times when they use the phone and they return the phones back and they're kept safe. And it becomes a good habit that they develop when they leave the ward as well.
No, excellent idea. I know certain people. I certainly do. In when we've gone out for dinner outside of lockdown, when the restaurants have been open, that we have a phone stack. So everybody, including myself, have to stack the phones up, and they're out of the way, and nobody touches them while we're having our meal, while we're having that discussion, because otherwise it's a huge distraction. And that is really, really great advice that, Abe, you've given us some real great tips. Really appreciate you joining us this evening. I'm also going to bring in Hitesh now. All three of you, please stay on, because Hitesh, you are a consultant in pediatrics, but you've found lockdowns really quite difficult. And what have you been doing to try and deal with the stress and the pressures that you have at work and everything else?
Yeah, it's been a difficult period, not just for me, but for everybody, I guess, and family as well, both in Leicester and further afield. I know family who've struggled with the stress of being at home, working from home, like I am at the moment, from a dining table, perhaps. But also the fact that they've been put on furlough or at very much risk of losing their jobs. And these are relatively young adults, with mortgages, children, all the things that we all need. And as I say, Abhay was talking about the necessity of life to keep your life running. And I found that several people that I know have ended up in a very severe place. People I would never in my life would have expected to have anxiety disorders, happy-go-lucky characters, not necessarily over-ambitious, but just living a healthy, normal life, but really struggling with that. And I found that quite difficult to tackle with, because suddenly people are going from being healthy and well to having quite a lot of mental stress and anxiety and ending up on medicines, antidepressants out of the blue. So it was a real shock to see that. Personally, I'm like Mangesh, and I'm lucky enough to be fit enough to do a lot of exercise and go running. I'm with a club, which had to actually stop meeting to do any running together over most of the last year because of the COVID rules. So I had to do a lot of running on my own, which is quite a big thing to take on, and can be quite laborious, especially during the winter months where you only it's usually in the dark and etc. So that's what I've been doing, but it's a struggle, and I found others have found it a struggle. Relatively young people, mostly men, I have to say, but that's not to say that women haven't been able to struggle with mental illness as well, and the struggles of the lockdown.
Yeah, and do you feel a lot better now? Is it generally coming out of it because of?
Yeah, I think the change in the environment in terms of light days and the summer and spring coming through in better ways, and you can get out more and then we can meet. Yeah, has been an important step for everybody, me included, to make us feel better and happier and a bit more relaxed. I would be much happier if we could go back to work in offices, but I think that's a way off for me, and for many of us, because I think we're way away from that, but that would be the next step for me.
Yeah. Okay, excellent. We're running out of time here, so I just want to say a big thank you to all three of you for all the work that you do in the NHS. I know you've done, spent lots of time looking after many patients over the years that you serve the communities. And on behalf of the patients of Leicester and Leicestershire, thank you very much. You're listening to Radio Ramadan on 87.9 FM. Please join us next week for the NHS